7:32. Well, it's January 3rd. It's the day. Indoor dining in Philadelphia, you'll be required to show proof of vaccination as of January 3rd. Now, there's a little bit of a grace period. We'll talk to our health commissioner, Dr. Cheryl Betigol, about that. Doctor, thank you for being with us again this morning.
Sure, it's a pleasure. Good morning.
Yeah, I'm going to admit something because I always try to be honest on the show here. I wasn't on a 2-week Christmas vacation. I was out for 2 weeks because I caught COVID again. Doctor, I got it again, and I feel like a fool because I delayed the booster. I was going to wait till, well, actually, it was the day before I got it. So on the 19th of December, I got COVID again, and I just tested positive. I was sick with it, down for about 2 weeks. So what my point is here, don't delay getting the booster. Now that I'm over it again, and there are a lot of people watching the show who probably are now over it again, when can you get the booster? Can I get it right away?
You know, that's a really interesting question. It's usually come up with initial infection and initial vaccination. In terms of when you can get a booster after an infection, I mean, I certainly would wait at least 30 days. The question is, should it be 30 or 90? And I'd be happy to get back to you on that. I'm actually not sure the answer to that.
Please do, because I saw somebody, I think it was on CNN, they were interviewing a doctor, and the doctor said, boy, the minute you get over it, go ahead and jump on the booster. But that was kind of off the top of his head, too. So if you could check on that.
Absolutely. It's a great question. But glad to hear you're feeling better.
Oh, yeah. I mean, thank God I got vaccinated. You know, I had two Pfizers because it was bad, but it wasn't as bad as a year ago when I had it. Oh, my God. So I'm thankful that I had the vaccine. Okay, so tonight, a lot of people want to go to the Sixers game. The Houston Rockets are in town. So what do I need to do if I want to go inside the Wells Fargo Center?
Well, there's a couple of things. So I know you're asking about the vaccine mandate. I would say, regardless of your vaccination status, if you're going to a Sixers game or you're going to any kind of indoor event, pay very close attention to your mask. This would be a great time to wear an N95, or certainly at least to double mask with a cloth mask over a surgical mask, because there is just a tremendous amount of COVID circulating in Philadelphia right now. And you can pretty much guarantee that there will be multiple people in there who do have COVID and don't know it.
Oh, yeah. But do I need to show proof of vaccination, or do I... You know, this grace period, I don't know about this, doctor. If you give me an inch, I'm going to take a mile, obviously. So, no, it really doesn't go into effect till January 17th.
Well, it does.
What's true?
In order to get in tonight, you'll either need to show proof that you've been fully vaccinated, according to the CDC criteria. So either 1 Johnson & Johnson or 2 Moderna and Pfizer doses. Or you have to show proof of a negative COVID test done in a lab, not a home test, that was done within the last 24 hours. So you're going to have one of those two things in order to get into that game tonight. Okay,
so let me make sure I get that. That was done in a lab. So it can't be the little test I got down from QVC, CVS.
It can't be a home test that you did yourself because there's no way of verifying that. You say it was negative. Who knows?
Right.
If you went to a mobile testing unit, if you went to a hospital, lab, wherever you went, that it was a professionally done test, and they give you a printout that you can show it was done within the last 24 hours, that's fine.
Okay. Hey, what do you think about this 5-day isolation idea that Dr. Fauci put forward?
You know, what we heard from the CDC on a call with our staff was that is intended for the general population, not for all the specific settings people keep asking us about. So not for long-term care facilities, not for prisons, not necessarily for schools. So we're waiting for more guidance on all of those settings. I think all of us are curious what's going to happen next.
Yeah.
There's been a lot of discussion.
Like you said, I don't know anybody who doesn't know somebody who has COVID right now. What was it, 25,000 cases in a day in Pennsylvania?
Yeah, and Philadelphia is averaging more than 2,000 cases a day, and the positivity is up to 29%, which means we are picking up a tiny fraction of those cases. So you can figure that in the city of Philadelphia, there are probably 25,000 cases a day of COVID. There's a massive amount of COVID out there. So if you are thinking of going anywhere inside with people you don't live with, this is a really good time to think about that again.
Yeah. Do you suppose it could get better after January now that we've had the Thanksgiving and the Christmas and the New Year's Eves parties?
Yeah, I mean, Omicron is hitting us really hard. It's also hitting us really fast. And, mathematically, it's just sweeping through the city.
Yeah.
So I do think this will be relatively brief, which does make it a little easier to hang on and say, hey, maybe a cozy January. Curl up, do things inside with your family. Know that February will likely be better, especially if we curl up cozily inside in January.
Yeah.
And when you do need to go out, when you're going to work, when you're out and about, really pay attention to your mask. Firstly, it should be over your nose, right? Everybody, I think we know this by now, but also the quality of the mask that you're using. Those single layer cloth masks are not doing much.
Forget those cloths. Let's go, let's go 95 if you can. Okay, well, let's hang in there. Thank you. And if you get back to me on that other thing about the booster, I'd greatly appreciate it. Thank you, Doctor.
Absolutely.
Okay.
Great. Have a great day.
You too.